that all have access to medical services, and particularly the poor who cannot afford the high costs involved in treating COVID.
The legislature has played a very important role in providing an enabling legal environment to manage the pandemic, and we urge members of Parliament to continue supporting us by passing the NHIF and omnibus bills that seek to further the health sector in the country.
There are proposals before you, proposals that will ensure that every Kenyan is able to have access to health insurance, because health insurance is the basis of us being able to offer universal health care.
NHIF is banking on Parliament's approval of the proposed amendments to expand its reach, which currently stands at more than 8 million members. Universal health coverage is being piloted at public hospitals in Machakos, Isiolo, Nyeri and Kisumu counties, as the government seeks to make quality healthcare accessible to all.
Please expedite the passage of these bits of legislation that will allow us to ensure that our people are properly catered for, not just during times of pandemic as we are, but always. And that is the purpose, access to quality health care.
The government's ambitious plan to have more Kenyans enlist on the national insurance health provider has faced some resistance from private hospitals who see the high uptake in NHIF as a threat to their revenues. Also, this new bill targets the youth who comprise 2/3 of the population. However, it does not stipulate how they shall remit monthly contributions to NHIF after the mandatory registration. At the moment, those in the informal sector have the option of contributing 500 shillings per month. Bridget's Ghana, NTV.
Definitely a report that sheds light on the hallmarks of quality healthcare. Affordability, accessibility, availability, acceptability, all very crucial in ensuring that all Kenyans can actually be able to attain the standard, the best of standards when it comes to healthcare. And today, as we said, the pandemic has literally underscored the importance of promoting preventative medicine as opposed to curative medicine. And we'll talk more about that in a moment. Now, just a reminder of a question of the day to you, and remember, this is based on our topic of the day, which is the impact of new media on healthcare. Have you been able to access medical information online? How has this affected your health and wellness? Have you been able to access medical information online? How has this impacted on your health and wellness? Now, to help us along with these conversations are those that have embraced this space and are actually churning out information that is not only educating but also empowering the masses too. And one of them is Dr. Christina Sule, who is an obstetrician and also a general and cosmetic gynecologist. Also joining us in the other studio is Dr. Brian Gala, aka Dr. Rain. He's a pediatric resident, and also joining us virtually is Dr. Nancy Nyaga, who is a clinical psychologist. Thank you all for making time for this conversation. And Christina, when you think about the new media and all the dynamics it has put to the fore in as far as healthcare, why have you gone into that space?
Well, initially, as a healthcare practitioner, when you start to go into the space, you wonder, is it something that people are going to need? Is it something that people are going to be able to access? But for me, I feel like the reason why I went in it fairly aggressively was more or less because of COVID, because it was not possible for people to come and access healthcare in a medical facility. According to the Ministry of Health guidelines and even the government, people were to stay away from hospitals as much as possible unless it was necessary. So because access was limited to hospitals, and because more and more people were accessing social media through their homes, I felt it was necessary for me to be able to convey medical information to people in the privacy of their homes or where they could be isolated. And so for me, I felt that was the best way to convey the important matters that I had to say. At the same time, I felt like a lot of information that is negative and not factual and harmful was being conveyed in the same social media space. So I felt like to correct this, I needed to be able to access the same social media space to give factual, relevant and up-to-date information.
And of course, you are in the reproductive health space. What are some of those gaps that were glaring, especially during the pandemic?
So during the pandemic, a lot of gynecologists and obstetricians noticed that many women were not attending their antenatal clinics. Many women were not coming in for their pap smears anymore. Many women were not doing gynecological cancer screening. And so this was becoming a problem. And in my personal opinion, I do believe that there will be an upsurge once the COVID pandemic has resolved to a certain extent of all these preventable diseases. We will definitely see a much larger, numbers of cervical cancer, of breast cancer, of ovarian cancer, not because we're getting more ill, but because fewer people were able to access screening methods during the pandemic. So for me, those are the things that I've seen so far.
Okay, so for you, Dr. Rain, you are in the pediatric space. Why social media?
It's very simple. We have more than 22 million Kenyans on social media right now. Also, if you think about it, anybody in the age group all the way up to 60 years old, if you're looking for information, once you have apps like Google, you start to check who can I go and see. If I'm looking for an obstetrician gynecologist, you're going to Google obstetrician gynecologist around me. You look for a pediatrician, you're going to Google pediatrician around me. So it's very simple. Everybody has access to internet. Most people have smartphones. The data there supports it. And it's very important. I'd like to highlight what Dr. Christina Sule said, that there's so much false or lack of proper education on our platforms. And I've seen that a lot of doctors or health practitioners have shied away from the online space, mainly because of judgment. A lot of us don't want to be seen as socialites. We want to be seen seriously as professionals and healthcare providers. But at the end of the day, I would really encourage health professionals to jump on this bandwagon on social media, where we start informing the public, because the usual means of informing the public is basically dead. The media campaigns that are usually done over the radio, over the TV, not many people actually go and follow that. People are on your Facebook, they are on WhatsApp, they are on YouTube more than they are on the normal mainstream media platforms. So it was only inevitable. I think COVID was a big push, since everybody had to stay at home. People had to work, some people had to work from home, those who were fortunate enough. And for me, it just came naturally, because I am a creative first before I became a medical practitioner. So the transition for me was quite flawless. I'm just working my way around it, and it's doing great for me. Okay. I have an online platform that people actually, I have sponsors now on board, and I'm educating the public. So it's even become a form of income. I have people on payroll right now that are benefiting from all this health-seeking behavior online.
Okay, and of course, pediatrics and the pandemic. What were the gaps that you saw in this season, or still continue to see?
So mainly misinformation. With the pandemic comes a lot of myths and fake news, wrong information, basically, the way it's brought about. There's been a lot of myths. Once you don't understand something, people fear what they don't understand, and then they start spreading all sorts of rumors. We have dealt with the most. We're still dealing with a lot with vaccinations and the vaccines and all the myths and so on and so forth. So for me, what really drove me was I am creating access to people for free to come and actually get healthcare advice and be able to improve health-seeking behavior online, so that you get it straight from the doctor's mouth. And these are all facts that we basically know. We try to update people on recent studies. I do a lot of updating on what's happening in the healthcare scene in our country. From what I've seen, even with your topics like cost of healthcare, are mostly covered. I've been doing a COVID-19 series on my page, and I think that's how you even found me, because I've really been educating the Kenyan public about COVID-19.
Okay, and Dr. Nancy Nyaga, you are a doctor of psychology, and amongst the panelists, I think I would call you the last born in as far as penetrating the social media circles. Why?
Oh, thank you, Gladys. And just like Dr. Sule and Dr. Rain have commented, I have never been on Facebook, and I think I found myself just feeling pushed to join Facebook last year because I literally got overwhelmed with clients going through depression and anxiety and a lot of grief and loss that people are going through. And I kept asking myself, there are very many people who will not be able to access therapy. What can I do in this space? And I had to get some time to shoot some videos to just get the information out there for people who will never be able to come to therapy, just to get to know what they can do, especially because of loss and grief, the relationship issues. We saw the suicide cases on the rise, marital issues, people breaking up, family members rising up against one another. And that is what got me out to start something on social media just to educate. And I like what Dr. Rain has said. But in our field, in mental health, one of the major gaps is stigma. That's what I realized. There are people who are suffering, but they will not want to be seen, going to see a therapist. And I can assure you, Gladys, what has happened after getting into this case, people have actually accepted to do more virtual sessions than visiting the offices. Mm-hmm. So there's actually a major gap that has been filled in our field by just accepting to get out there, pass the information, and people just getting to know they are real professionals. And like Dr. Sule and Dr. Rain, our field is also infiltrated with people who are not fully well trained. Somebody will do a certificate in counseling and say that they are professional and can do the work. So you find that we may have a lot of people who are not very well qualified. Mm-hmm. So getting information out there and getting people to know that they are professionals who can be able to take people through who are going through severe depression, take them through therapy and get them to be okay has been very significant for me.
And definitely the mental health space has been again underscored by the pandemic and the importance of having this information so that one can actually also harness their own health and wellness. And now that each of you has their own discipline represented here, let's start off with Dr. Christina Sule. If we can have her video on screen.
Yoni products, some of you are not going to like this talk, sorry, not sorry. Yoni products are not FDA approved. The manufacturers do not have any requirement to state what the constituents are. They cause infections. They promise vaginal tightness, but actually they cause dryness, and tightness is not dryness. If you want vaginal tightness, you can have this done surgically or non-surgically by a cosmetic gynecologist. Also, they don't treat infertility.
Okay, so that's Dr. Christina in her element when she is in the social media space. And in this case, she was talking about some of the misinformation that comes with your reproductive health. Now, we know there has been a lot of it heightened during the pandemic, but these issues have always been there. What have you seen that women and men perhaps struggle in this space?
The thing is, with the pandemic, there became a lot of highlights on yes, there is a pandemic, but there's other things in your health that you need to look out for, in your reproductive health, in your sexual health. And so initially when the pandemic started and I began to do social media, I got a lot of women coming with menstrual irregularities, menstrual disorders, a lot of pain during menstruation. And so I collaborated with quite a number of influencers, and we kind of spoke out to say, look, yes, there's a pandemic. Yes, you're at home, you're isolated, you're keeping safe, but these are the things that you need to look out for. And after that, then more issues arose. And I feel like the pandemic is not necessarily a bad thing that happened to us. Yes, there have been several, deaths, several people getting unwell, recovering, but I feel like it has made us realize, okay, what else is happening to my body? Yes, there's this thing, there's a pandemic, there's a disease that affects your lungs, it's a virus, you need to wear a mask, you need to wash your hands, but what else is happening to my body? How is my ovary looking like? What's my uterus looking like? Is my cervix okay? Am I able to get pregnant? When I get pregnant, what are the danger signs? And so that's the thing that I've been, kind of trying to highlight. But even other than that, because I feel like a lot of people have had more time to be at home, and sorry to say, be more idle, more people have gotten involved in practices that are actually harmful to them. And so these are the things that I wanted to highlight, like, look, yes, you have lots of time on your hands now, but don't do 1, 2, 3, 4 because it is actually harmful to you. And I felt like it was best for people to hear that from a professional. As Dr. Rain said, that there's so many people on social media giving all sorts of information, but when the information is not just relatable, but also can be relied upon, and is factual because it's being given to you by a medical professional, that's the best kind of information that you require.
Okay, now when we started off, you mentioned getting into this space, you were not very sure what the uptake would be like. When they reach out to you, is it because they're hungry for the information, or do they just want to come and clarify what they've already heard?
So it's because they do want the information. It's because they have seen the symptoms in themselves. It's because they have had a close, person close to them having experienced that. And they say, oh, look, this is what I see in myself. Is this normal? Or they say, look, I watched your video on this and this is what I've been experiencing. I'd like a diagnosis. I'd like to not just sit at home and feel like, is this actually happening to me or not? They want to actually have a diagnosis. Some of them just want clarification, but I can tell you, those who want clarification are so few. Many of them actually want to be seen and to get a diagnosis and to get a solution to their problem.
And speaking about hunger for information, this is Dr. Rain on his social media spaces.
Our exclusive breastfeeding rates are still relatively low, okay? Our biggest problem in this country, is not the advertising or marketing distribution of formula. Our biggest problem is supporting the woman, looking at the woman as an individual and not looking at her as a woman and a child. Understanding the woman, not expecting a first-time mother to have this motherly instinct that breastfeeding is natural. It doesn't work like that anymore.
Dr. Rain, you underscore the fact that there's a lot of misinformation, but that video also alludes to the fact that there are some parts of healthcare that have not been spotlighted, so to speak.
Wow, healthcare in our country is less than optimal. We are basically doing with what you can, and COVID-19 has exposed that. That was a small clip when I was speaking about the whole taxation, the increasing of tax, and especially on infant formula. And it's a very sensitive topic because we have actually what we call the International Code, and in Kenya we have the Breast Milk Substitutes Act, where we try to minimize the marketing and distribution of infant formula. But at the same time, when you increase this formula, you're not giving the mother another option. For example, when I released that clip, it brought a lot of emotions. One of a popular, I'd call him a celebrity, but I don't want to give him that title. Ted Josiah hit me up and told me that he lost his wife 3 months after his kids were born. So you can imagine, you lose your wife, these kids go through 2 tins of formula, which is approximately almost 2,000 per tin. So in a week, you're talking about 4,000. In a month, you're looking at 16,000. He had recently lost a job, and he has these babies he's looking at. He cannot give them cow's milk because cow's milk is dangerous. This is milk from a cow. You need milk from a human being. And formula is the next best thing that can actually help these kids. So when you start taxing and you don't think about other situations, when you start terming or classifying mothers as Kilimani moms, or these mothers who don't want to breastfeed, and put them in a box, then we have a problem. We need to educate, and that's why I feel online is such a powerful platform, because I don't need much. I don't need the expensive studio. I don't need the expensive equipment to get my reach out there. I just need a smartphone, I need data connection, and I inform the people. But at the same time, it does have its downside. What I would say is be very careful where you seek your healthcare advice. Don't seek it from other, especially for me in the pediatric world. Dr. Christina Sulekan is my colleague in obstetrics, because she's the one who's with the mother all the way up to the baby is delivered. So from those stages, when these mothers go and reach out to other moms and ask them what they have done, what are the things they're doing, some of those things are based on their experience and not actual facts. And then look at us for healthcare. We will provide you with the information. But when it comes to detailed consultations and things like that, then that's where it can become very unethical. So for anyone that needs actual consultations, we usually have links where they can actually book an appointment so we can see these patients. We're not there to do online consultations for free. There are other avenues to do online consultations. You can have an online consultation so that we get to know the basis, but don't hit up the doctors in the DM and say, hey doc, I have this problem. No, it can't work like that. You'd have to go through the proper route of access to get to the healthcare provider.
Okay, I like that clarification, because it also is governed by the medical ethics of how you actually carry out your discipline. Now, speaking of which, as I mentioned, mental health has been very, very crucial during this time, and information about the same has really empowered the masses. Let's take a look at a video that Nancy has done on her media platforms. Okay, we still don't have that, but even as we wait for that, Nancy, what are those huge gaps you have seen and are actually trying to seek to ensure that those who need them can actually get the information they need?
The gaps are quite many. I think I had already mentioned one, the stigma that people have when it comes to mental illness, because we easily can talk about physical illness and even talk about seeing our dentist or our other physicians. But when it comes to mental health, the label that is given, that someone is crazy, someone is wacko, we know the labels that people are given. And what I see is that people just sometimes come to the clinic just to hear that they are not crazy. They have done all those online assessments that are put there for depression and anxiety, but they want a professional to confirm to them. So in the season of COVID-19, it was even worse because of the physical isolation that caused people not to connect. The gym that people would be able to go and exercise, social places where people would connect, places of worship, human beings being social and all that. That need was really affected by the physical isolation, and that exacerbated the symptoms of mental illness. So we saw the rise of depression, anxiety, drug and substance use, marital issues, and therefore, we needed to get out. I needed to get out some information just to let people have better coping mechanisms, so that they can stop exacerbating their symptoms of anxiety and anticipatory loss that people were experiencing, because there was so much fear about catching COVID or even getting infected. And that would cause people to even be anxious, have sleep problems. That was a major symptom that people showed up with in therapy, experiencing a disturbed sleep. So some of these things, then people would go into alcohol, prescription medication to be able to support themselves to sleep better. Unfortunately, then that always exacerbates the symptoms of mental illness, causing them to sink further into the problem and even get more severe.
Okay, Nancy, now we finally have that video of you just showcasing what it is that you do on the social media space.
learn from the experience and evaluate and keep wanting to connect, but take your time to heal fast. Do not get into a rebound relationship. Another most important point is to ensure that you do not compare yourself with others. There are those who are in and out of relationships and they don't take time to learn. Take your time to understand what happened in that previous relationship. Take your time to know who that person was and who you are and what happened in that relationship that made it not work, so that you don't take that baggage to another relationship.
Well, that video alludes to the importance of introspection. And I think with all this, changes, people being at home a bit more, having more time to themselves, they've come to that realization. Do you have people walking in and saying, there's some things that I have been struggling with and perhaps I would need direction with?
Oh, yes. Gladys, in our work, by the time people show up for therapy, they've tried all manner of things. I get people coming in and they say, Nancy, I was given your contact last year, January, and this is the following year, January. And I ask the reason why you're given, is it the same reason that has brought you to therapy? And they say yes, because there is a lot of stigma, like I said. So you're working, you look nice, you have a family, you have a good job going. So when you're talking to your family members and friends, they tell you, no, Nancy, you don't look depressed. What do you mean? You have a good job, you have a good family. There's no way you can be depressed. Snap out of it. Family members will tell you that you're a Christian. You believe in God. You cannot be depressed. So many times, by the time people show up in therapy, the symptoms have moved from mild to moderate to severe, and they have tried a number of things to try and deal with their symptoms. So I always ask people to understand that in mental health, prevention is always better than cure. So they need to come in early so that they can be supported, so that they don't even have to stay long in treatment. Because by the time you're showing up and the symptoms are so severe, then you're going to take a little bit longer in treatment, whether in psychotherapy or whether you need to see a psychiatrist for medication. That will take you longer to heal. So I would really urge the masses to understand in mental health, when you show up early, when you get the symptoms, get to be checked, get to be given the tips, how to deal with it, how to protect yourself, to do your self-care, so that then you don't have to be in a long-term treatment for that problem.
Now, when we started off this conversation, I made note that the hallmarks of quality healthcare include affordability, accessibility, availability, and acceptability. Dr. Christina, when you think about information about reproductive health, do people have delayed diagnosis majorly because they cannot afford to even go see a specialist?
Yes, of course, being a third world country, we do have delayed diagnosis because of cost. That definitely happens. I have a YouTube channel called Your Free Consult. And the reason why I started it fairly recently was because I felt that women need to be able to have a free professional consultation with a doctor. So it's not an actual consult, but it's the first step to a patient being able to recognize their symptoms so that they know where to get help, where to get it in an affordable manner. And so, yes, there is a delay in diagnosis. We get patients who come with stage 4 cervical cancer, and when you ask them, have you ever had a pap smear, their response is, what is a pap smear? And so I feel like that is very unfortunate, and a woman should know what a pap smear is, and then the second step would be for her to be able to afford to have one, or alternatives that cost cheaper to be able to screen for cervical cancer, and then she can be able to have, whatever lesion treated. So there is a significant delay because of lack of information. There is a significant delay because of cost issues, and we generally, as gynecologists, do see very advanced stages of diseases, ovarian cancer even, at a very advanced stage because of lack of information. A woman doesn't know that, look, if I bleed after sex, this is a danger sign for cervical cancer. I must get screened. And so these are problems that we do try to solve through our online presence. Of course, as Dr. Rain said, it does cause a bit of a problem because our colleagues do see us probably as socialites or celebrities. But it's one of those things that is eventually going to have to happen. As Dr. Nyaga said, you feel forced into the social media space. But the reason why it forces you is because we've taken an oath. And our oath is to protect the health of our patients. And when a patient walks in and says they don't know what a pap smear is, I feel like as a medical professional, you have failed.
Yeah. Okay. And Dr. Rain, for you, what is the impact of lack of affordability, especially for those who would want to seek your services?
Let me say that it's bigger than healthcare. The world is built on capitalism, and if you don't have money, you will not survive in this world. Your lifespan or your life expectancy will be much, much shorter. So what do I mean by capitalism? I like the way Dr. Christina Sule has started. We were given, or we took a Hippocratic oath, you know, to uphold, to offer healthcare. And if you look at that Hippocratic oath, there is nothing about healthcare being a paid service. It is something that is part of humanity and that you should help humans. But at the same time, in our medical education, we are not taught about the business side of the healthcare. It is not taught in medical school. So when you have to deal with insurance, you want to offer help, but this person tells you that they don't have medical insurance. This hospital says, you can't see this patient, they don't have health insurance. Or you want to help this patient, but this particular hospital doesn't have the infrastructure, doesn't have the drugs due to certain cost-related implications. And most of the time, it's to deal with capitalism. So if you have money, good for you, you have the best access to healthcare. And I think we need to talk about the root cause, which is capitalism and making healthcare into a business. When healthcare is a business, we can't start talking about Hippocratic oath and healthcare is a business at the same time. You can't eat your cake, you can't have your cake and what's that?
Have your cake and eat it. Yes.
Yes, you can't have your cake and eat it, basically, yeah, because it's two conflicting things. Here we are talking about, we are training people to help, but at the same time, the world wants it to be business related. Look at what is happening with vaccine apartheid and vaccine inequality right now. We are 1% populated in Africa, when the Western and the US countries are almost at 100%. They have purchased all these drugs. They have the patents and the intellectual property to these vaccines, so we can't even duplicate or we can't make generics of this vaccine to give to other people. And we're just there watching. So how can we talk about healthcare being equal or universal healthcare coverage when it is a business? So healthcare is a business for now. It is run by capitalism. If you don't have enough money, you will probably die faster than the person who has money. That's just facts.
Okay, very, very hard facts there. And even as a pediatric resident, what are some of the things you see mothers struggling with their children? And if only they could have come to you a bit earlier, perhaps it would have been averted.
I think the information is lacking. Like I said, our mainstream media platforms people are accessing healthcare online. So there's a big gap, yeah? For you to be able to access some of the information I give out there, you need to have data. You need to be able to buy bundles. Most people might not. There is a certain population that can't afford that. There is a certain population that still can't afford smartphones. The other thing is what I talked about, simple things like infant formula. We need to start thinking about how this can be more accessible to the poorer society. We're protecting mothers by trying to help them exclusively breastfeed, the ones who are employed in the formal sector. And this accounts for around 3 million people, but there's over 18 million who are in the informal sector. They don't have maternity leave, they don't have workplace support to support the breastfeeding mother. So these are the people, the mama mbogas, your wanjikus, if you may, who don't have this support, yet they give birth and they have to rush to keep a job. They have to rush to the market. They have to rush to come and take care of your kids that you can be able to provide for them, but they can't provide for themselves because of affordability, because of lack of rights. Remember, our constitution says we have the right to the highest, most attainable and quality health care. So that should be implemented across board. We have a lot of work to do in terms of health information. We need to be more accessible, speak the language of the people.
Yeah.
There's different audience. My target audience is mainly the middle class. And the reason I've put myself in that category is because these are the people who can afford Wi-Fi, they can afford bundles, and when I'm speaking, they can understand because they managed to afford an education that got them all the way to university. So they have some knowledge about biology. When you're seeing other mothers who are from really low economic status, it becomes even hard to explain things like why your baby is sick when you haven't had basic biology or basic science to know how the lungs work, how this works. So we have a big problem. It's not just in the healthcare, it's within our entire system. We need to get rid of capitalism. We need to improve our education, improve our healthcare, and improve our general systems generally. So get rid of corruption, things will get better.
Okay, and I love the fact that you keep highlighting breastfeeding, and this is coming ahead of the World Breastfeeding Week coming up in the first week of August, from the 1st to the 7th of August. The theme this year is actually shared responsibility. So a lot of what you're saying actually goes to affirming the same. And Nancy, you had talked about people coming to see you perhaps a bit too late in the day, and now they're dealing with bigger problems than when if they had come to see you earlier. How has the fact that I cannot afford to come and pay you that consultation kept so many people from accessing mental health care?
Yeah, that has been a major problem because therapy is expensive. Remember, in psychotherapy, we don't give any medication. There's a lot of self-care that you take the person through, things to go and do. When you're talking about distorting their thoughts that maybe maintain the depression or the anxiety, it is something that they have to keep doing by themselves and for themselves. So most sessions that are going to be productive or effective, they must be weekly or bi-weekly. And because they pay a consultation fee that is a constant, then it becomes quite expensive. However, I need to say that I'm glad that almost all insurance companies now are covering psychotherapy. So many people then are able to afford to come for therapy because it is covered. However, like Dr. Rain has said, it's also difficult because there are many people in Kenya, majority actually, who are not able to access, even have an insurance cover. Even in HIF, for example, as cheap as it sounds, there are very many people who are not able to afford it. So it's the gap we may feel, and I think I have tried to fill that gap in a way by just taking the education, even through local media, vernacular stations. I have done a lot of that, and even in places of worship. I have talked in very many churches, local media, about mental health, because you equip people with tips that they can take up and go and use. Yesterday, I was in another media house, and at the end of the show, there were very many people who texted talking about wanting to commit suicide, and you get the numbers. And what I normally do, especially for suicide, because in mental health, it is an emergency. You get to engage them and to get to hear the reasons why they would want to end their life, and be able to educate them and tell them they are actually not ending their problem, they are ending their life. So the need is huge. The need is huge, and I'm also glad that the government has started employing psychologists and counselors in hospitals, all the way to the dispensaries in the country. There's a plan in the universal health to be able to do that. And that would support the mental health field as we get more people supporting the populace. The psychiatrists are very few in the country as well. So this also makes it difficult to get the help that people need, especially when they need medication. We only have one major mental health hospital, that is Mathare Hospital. So looking at every county, looking at trying to see whether they can have a hospital that would cater for mental health is also important for the government to consider that, because mental health has really been on the rise in the country. And it is a high time, as the new act for mental health is considering, and actually requested the government to consider mental illness as an emergency. so that they can be able to work on it and help create more health care solutions in that area and in that field. For indeed, there is no health without mental health.
Very well said. All right, we take a short break here on Your World. When we come back, I'd like each of you to touch on the role of the new media, especially in promoting what I mentioned, preventative medicine as opposed to curative medicine, which is what we see a lot of in this country. And I'm told before we take that break, we actually have some feedback from that question we posted to you. And that one is, have you ever accessed medical information online? What has this or how has this impacted on you? You can let us know. That is a new normal. We have Agumba Steve who says the online platform serves well when it comes to medical information, and I must confess that it's always readily available as regards guidance on health matters. Thank you, Agumba Steve. Another here from Barrington Ketuta who says some private hospitals charge too much even after the patient dies. Barrington, we hear you, and we'll take more of your feedback right after this short break. Stay with us.
At Ruiru Mabati Factory, you can open an account and lipa pole pole at your convenience. Did you know at Ruiru Mabati Factory, you can get customized sizes according to your roof plan to avoid wastage? Did you know Ruiru Mabati Factory offers free delivery countrywide within 72 hours? Call us now on 0111 050 700. Ruiru Mabati Factory, mali safi kwa bei poa.
For an exclusive fragrance experience, try Nivea Men Deep Impact Body Lotion with a long-lasting woody fragrance, deep moisture, and a fresh skin feel. Make an impact with Nivea Men Deep Impact. Nivea Men, it starts with you.
Max?
Tusizoeane. Niite Mr. Max.
Mr. Max, uko sawa?
Niko salama.
Please, I didn't mean to hurt you. And I would never ever hurt you like that. I'm sorry. Sorry, baby.
It's okay, sawa.
When nani?
I'm Renee.
You're the one dating Joey's dad, right?
We're married, actually. Where's Joey?
See you soon, babe.
Pieces of Us in association with Nivea Nourishing Cocoa Body Lotion.
It's time to show off your best skin. Wear your skin with pride every time with Nivea Nourishing Cocoa Body Lotion.
This week on EdTech Monday Kenya, we focus on the top education challenges that technology can address.
There is issue of inclusive education, where you are talking about people with special needs. How well are they taken care of using education technology?
One of the challenges of education is how we make it a fertile field for innovators, not just to perform and be productive, but also to prosper.
The best type of technology is the technology you already have. Is we need to design solutions that provide content to those students through the particular modality that they have access to.
Join us on NTV Kenya at 4:30 p.m.
West Africa had the most NBA draft picks last year. The continent has also seen heavier investment in sports across the last couple of years. How then do you bring this to talent, investment and global eyes into one particular league and hold it on an African country but set to international standards?
I'm inspired by anything. Like literally I can just look at an orange and I can see a whole room out of that orange. I did my first solo client whilst I was studying interior design at uni. I just realised basically that this is for me.
Now, as the state of the economy continues to deteriorate, I'll be finding out from ordinary Zambians how they've been coping during this difficult economic environment.
Wow, thank you for your time. How juicy.
Juicy.
Thank you for staying with Your World. My name is Gladys Gachanja. Today, we are looking at the impact of the new media on healthcare. And still with us in studio, we have Dr. Christina Sule, who is an obstetrician and also general and cosmetic gynecologist. In the other studio, we have Dr. Brian Gala, aka Dr. Rain, who is a pediatric resident, and joining us virtually, Dr. Nancy Nyaga, clinical psychologist. She is a doctor of psychology. Thank you guys for making time. And let me start off with the fact that this space has really gone a long way in empowering the masses, which means it is also promoting preventative medicine as opposed to curative medicine. I mean, they say prevention is better than cure. How have you seen this in your line of work?
So there's definitely a huge influence on the new media on preventative medicine, because that basically is the first step that the patient is allowed to take when they access social media information regarding their health. And preventative medicine does go with curative medicine. For me, the changes that I've seen when I got into social media and started releasing, credible medical information is that I got many more women coming in for pap smears. And for me, that's a fantastic thing. Not just knowing what a pap smear is. So when a patient now walks in and I ask her, do you know what a pap smear is? She's like, yes, I watched your video. And for me, that's a win, because now she not just came to do a pap smear, but she also knows what it is. And so with lots of more pap smears being done, lots of women doing more breast exams, lots of women being aware, for example, of the symptoms of ovarian cancer, lots of women knowing the danger signs in pregnancy through social media and credible medical information, then they end up coming to the doctor, and a lot more screening gets done. And so a lot more detection of cervical cancer, and it being able to be sorted out at a very early stage, which is the best time to sort it out. And that goes for all the gynecological cancers, a lot of the reproductive health issues that women have being screened and detected much earlier. I got a lot more people coming in for the human papillomavirus vaccine, which is very important in preventing cervical cancer. And so for me, that's a win as well. And you see, the thing is, with preventative medicine, there is after that, with preventative, there is then curative. They go hand in hand. For example, if a woman were to do a pap smear and find that it's abnormal, it's my job as her doctor to then convince her that, look, this is how we're going to solve this issue. This is how we're going to treat your abnormal pap smear. These are the steps we're going to take. And so eventually you do get cure. There's no preventative medicine without curative medicine. And so a curative medicine then benefits as well. So those are the things that I've generally seen in terms of preventative medicine. I really did have an upsurge of pap smears and HPV vaccine and ovarian cancer screening and breast cancer screening. And for me, I feel I've achieved when that happens.
Okay, and Dr. Rain, when you think about a mother bringing in the child and we say that as it is, there is a crisis of over-the-counter, you know, healthcare access, especially when it comes to the child. When they cough, you go get a syrup. When they get a flu or they have, you know, they have a fever, you go get an antibiotic, which in itself can actually start or cause other issues. What is the balance that this information online is offering to these caregivers?
Well, thank you for bringing that very important thing in kids. And if people haven't gotten it from my social media, let me just say that we do not prescribe cough syrups or flu medicines for children below the age of 6 and even up to the age of 12. So no more cough syrups. If you go to the pharmacy, and this is another thing, we have a big problem with pharmacies. And we have good pharmacies, but some people, like I said, healthcare is a business. When you go there and you're trying to avoid the consultation, sometimes I understand they're trying to avoid that extra cost because they feel if I go to the doctor, he's going to just write me the same things. So let me just get it from the pharmacy. The pharmacy needs to push their antibiotics. They need to push those cough syrups off their shelves. First of all, antibiotics should not be prescribed over the counter or be issued over the counter. It is illegal according to the law. So what I would say is from this whole thing, I'd like to refer back to breastfeeding because that is what I've really been advocating for, and I can see change. When I have mothers come and see me, whether it's an online consultation, whether it's consultation in the Well Baby Clinic, and say that they actually watched the breastfeeding videos that I've done on YouTube and it has taught them so much, or mothers who are expectant and you meet them and they tell you, oh, I saw you on such and such TV station and you were talking about breastfeeding and it really opened my eyes. So that is the kind of preventive medicine that we are trying to educate and try to teach to all the people out there in our relevant fields. And that is good because the cost of healthcare is so expensive. So we are trying to prevent because the chances of you affording the consultations, I have people struggling just, you know, even with my consultation fees, you know. Some people I have to do a lot of pro bono. I understand the COVID pandemic, people have lost jobs. I try to make my phone line as, you know, as accessible as possible, and I'd be able to sort of help out with certain things. But at the end of the day, this social media is a beautiful thing. It is making a big difference, and I think we are getting there. We just need to have more people on board. Next time you want to see more people talking about cancer, we want to talk more people talking about basic surgeries, we want people to talk infectious diseases, not just on these very beautiful big platforms, but on social media and just getting across.
And definitely accessibility is something else that comes to mind when it comes to accessing healthcare. Now, Nancy, for you, the beauty is that the COVID-19 pandemic has now brought up other avenues of accessing medical help. For example, telemedicine. You know, you can now switch on your computer and be able to speak to those that seek your services. How has this changed how you do your work?
Fortunately for me, Gladys, I have been doing virtual sessions even before COVID because our work, we are able to do online sessions and even do online assessments because all you need to do is, like, for example, share or transfer a file to a client where you can assess their depression level, anxiety level, or whether you're testing for bipolar or whatever condition you'd want to test for, and score the results together and be able to tell them, you score this figure or this number, and therefore your depression is severe or moderate. But during COVID-19, I had actually to pay for a better platform where my clients do not need to have an app called Doxy.me. where they just click on a link. I send them a link and they click on it, and there they are ushered into a room where I'll allow them to enjoy their session. What this has brought is even reduced the cost of the healthcare, because they will need to take time off work, time off business, so they can actually get into their car and do their session. Even if they are in their home, they can have had sessions where people are actually in their bed, because they only need to click on and we can be able to do the session. They don't have to drive all the way to my clinic. They just need to log in. So there has been a major reduction in cost and time wasted, and also reducing the stigma, because nobody really knows who you're talking to. You just get into your car, your earphones or wherever, or even in a corner somewhere and do your session. So what this also has created is more awareness about mental health, people being able to understand that they can be checked, that there are tests and tools and proven techniques that are used to help them deal with their mental health issues, relationship issues. I have couples who sign in or log in from wherever. One is at home, the other one is in the office, and we're able to do a virtual session and be able to support them better, so that even when they come to the office, they are not fighting because they're not seeing one another. And you can still do the assessment as you share on your screen the tools that we use to be able to assess what is happening in their life. So that has facilitated our process better. And I would say telehealth, especially in the area of mental health, is a way to go, because all we need, and I'm able to look at you, see when you're balancing tears, read all the non-verbals that I need to assess when we are doing our session virtually. So I can still be able to get to know what is happening. Physically in the office, people are in masks, and I have discovered as a therapist, the mask everything. So the face has a lot of things we do while we are doing our observation. So telehealth has been more effective for me in assessing people while we are doing therapy.
Okay, and Dr. Brain, how has telemedicine also propelled your discipline, considering that those that will, consume your information, but some never translate to actually coming to see you or to see a doctor?
So for me personally, I think the telemedicine thing is a beautiful thing. It just needs to be regulated properly. Right now, we actually don't have any laws. There is a bill that is being proposed by the Medical Board, Medical Practitioners and Dentists Boards Council, and they're trying to sort of regulate it so that they make sure that you have records that are safe. Patient information is very important. Your privacy is very important. Medical, legal issues. And for now, what I'm seeing is that most of those people on board are the big private hospitals, which in essence is going to be less of a productive way, because it's easier if the people can get access to the consultant directly, right? And we have social media apps that actually deal with telemedicine and how to develop all these apps. So it would be very, very good and prudent to have all these apps coming up so that we have good records, good IT services, good backing up and logs and all those things, and patient records and files, which are very, very important to improving healthcare. I know a couple of my colleagues that are doing telemedicine. I'm not so big on telemedicine myself. I do prefer to see my patients in the clinic. Dealing with babies is a very, very sensitive thing. And that's why I always tell mothers, sometimes I can't consult with you over the phone. I'll give you the information. If you suspect that there's something wrong or your child could have this, please bring them. Let's take a look. I need to physically examine the baby and know what is really going on, because sometimes the information that may be sent over the phone or on the call might not be as accurate. And with kids, it can they can change just like that, and it leads to an emergency. Then the next thing you're told that, oh, I called the doctor and he told me not to worry over the phone, and things like that. So it's very important that we have regulation in place. Let's support the private consultants when they do this telemedicine. Let's not only have it for the big hospitals who have infrastructure and have more financial power to actually get on board and roll this out. We want it to be as accessible as possible to everybody.
And for you, Christina, what has the experience been?
So I do actually have telemedicine services in my clinic. As Dr. Rain has said, the structures are not quite well placed according to the Kenya Medical Practitioners and Dentists Council. So, and as what I've learned, even as getting into social media, sometimes when the structures are not in place, you kind of just have to be able to place structures for yourself to be able to get what you need done to get done. And so for me, I do offer telemedicine services, but it's not as simple as we would like it to be. I have patients in all over the world, in Qatar, in the States. I have patients in other counties in Kenya, in Mombasa, in in Kakamega, in Nakuru. And so for me, the process is that there is a telemedicine consent form that the patient has to sign, and this consent form includes the fact that I'm not able to examine you physically, which I really do need to do. And so as a patient, you need to know if my condition is actually urgent, I need to be able to go to a hospital. This doctor has not examined me, and they have to consent to that. And all the limitations that come in with a telemedicine consult, they have to consent to that. They also have to consent to the fact that at some point I may require another doctor closer to them to be able to examine and communicate the information to me, because I'm not actually physically there to be able to do that. Again, for women who are pregnant, because that is a very sensitive area for me, sometimes I am not able to do telemedicine consults because I'm not willing to take the risk of offering someone a telemedicine consult when they're actually pregnant. So if it's not an urgent matter and it's something that's chronic and they're willing to have, for example, if they're in Nakuru and I ask them to do certain tests and things are not adding up, I may ask them, please go and speak to your nearest gynecologist and have them call me. So they need to be consenting to that as well, and to the fact that I have not actually physically examined them, which is a critical process in evaluating a patient. So I do offer, but with limits. I think it does make things a little bit better, because it sort of pushes a patient out of their comfort zone. They say, oh, there's a doctor 10 years ago who told me that I have fibroids, but I've never been diagnosed, so what do you think? And I'm like, okay, let's do a telemedicine consult. You're in Garissa. Have an ultrasound done, show me the ultrasound, what else are you feeling, have another doctor get involved. So it's a tricky space, but it must be a place that gets more refined. It is a place that doctors will have to get into, whether they like it or not, because it does help patients to a certain extent and with certain limitations.
And definitely, as we were saying, it's an inevitable space that medical healthcare is going into, and the impact of a new media cannot be understated. But the question here is, should this space be regulated to, to ensure that we weed off the quack doctors, perhaps, who can make an extra buck due to the hunger that patients want? Dr. Rain?
Well, when it comes to quack doctors or doctors who are not licensed, it's very simple. The Kenyan Medical Practitioners and Dentists Board actually has a list online. It's available. You can go and check out their website. If there's any doctor claiming to be a medical practitioner, they should be registered and licensed and board certified. We usually do that every once a year. We have to update and renew our licenses to be able to practice. So if you're going to see so-and-so, make sure that you type in their names and they're there, especially if you're having some doubts, right? The other thing is there are different types of quacks, right? So there's different fields, there are different people who claim certain things. That's where information, it's very important for people to understand how to disseminate actual news and real facts from fake. And that's the problem we've been having. A lot of this COVID-19 myths or any healthcare issue that is not factual is usually spread through conspiracy theories and things like that. But you would find that if you just dig a bit deeper, refine your search on social media or whatever platform you used or search engine, you will be able to differentiate between what is true and what is factual. So already we have some structures in place. They just need to be fine-lined. Telemedicine is really, really the future, especially what I'd highlight for me, I would talk about education, the same thing that I'm doing for free on social media. So when a mother has issues with just needs breastfeeding education, it's a perfect opportunity. You don't have to come all the way from God knows where. If your child is okay, you just have some issues with breastfeeding advice, nutritional advice, and different things, even just the psychological. We see a couple of teens who deal with a lot of things. So you'd want to speak to the teens on such apps and find out what is really going on away from the parents, so that you can know, okay, are we really having an issue, so that you can refer to a psychologist or refer to a psychiatrist, whether we're dealing with mental health issues. So it's a beautiful platform. It needs to be regulated. The money-hungry industry, health industry, really needs to step back and make this a platform that is actually beneficial to the patient and the provider, especially the healthcare provider, instead of it now becoming a multi-million dollar business that it has the potential to become, just like any other healthcare.
Very well said. And Nancy, before we take a short break here, there's somebody who is asking, what is the difference between me going into Google and asking the question that I need and getting the answers I need, as opposed to now me coming to you virtually and getting the information that I need?
Yes, that's a big one, and I always get to explain to my clients the difference is, like, for example, Google will not ask you what else you're experiencing. If you're sad, if you're crying, if you're not sleeping, it could be because you have lost somebody or somebody has died. You're not depressed.
Yes.
So Google will pathologize you and tell you you have depression. But when you come to Nancy or a professional, we'll be able to assess and see what else is happening in your life that is causing you to almost experience in terms of depression, although you don't have depression really. It is because of the things in your life. So many people come in when they have pathologized themselves or been pathologized by Google, but we are able to clarify that this is anxiety or this is depression, or it is not a clinical problem. It is because of what you're experiencing or what you have gone through in your life. And therefore, we take them through tips of how to overcome that instead of having medication. If it's a clinical problem, then we work with a psychiatrist and refer them for medication.
Okay, and now I saw Dr. Christina make a face for, what do you mean, Google? Why?
Yeah.
We do get a lot of those patients who, you know, say, oh, I Googled this and I Googled that.
Yeah.
You see, the thing is this with Google. The medical professional that you have gone to see has undergone training to be able to decipher the information that appears on Google. I Google a lot of stuff as well, but the way I Google it is not the way a patient Googles it, because I have a medical background. So we are trained to be able to decipher medical information in a particular manner. And many times, Google is not going to give you the complete information. Google is not going to be able to know, as Dr. Nyaga has said, the additional things that are a problem. You might type in 1, 2, 3 symptoms, but when I examine you, I find a third, fourth, fifth sign that I'm going to add up and say, actually, no, it's not the Google diagnosis that you had Googled. It's something completely different. Google is not, I don't worry that Google is going to replace doctors. Nothing can replace a human touch. Nothing can replace that thing that a human person who has had a medical training will give you, as opposed to just finding information on a screen. And it should never happen.
Okay, Dr. Rain, even as we take a break.
Yeah, so Google does not diagnose you. You cannot go to Google for a prescription. You cannot go to Google for treatment. You can Google COVID-19 symptoms, but that's about it. Yeah, we have to differentiate. Is it COVID-19 pneumonia? Is it a bacterial pneumonia? Are we dealing with the respiratory distress syndrome? Are we dealing with acute respiratory distress syndrome? Are we dealing with tuberculosis? Are we dealing with asthma? All of those symptoms will be there when you Google COVID-19 symptoms. So listen, Google all you want. When you get that information, come to us. Let us help you decipher that information, or reach out on our online platforms and say, you've Googled this. Can you please explain what this means? And that's it. Google can never replace doctors. It never shall, never will.
All right, you heard it from the horse's mouth, so to speak. We take another short break here on Your World. We'll be right back.
Are you on Nyota? Pata channel sita zaidi when you pay for more than 1 month on Nyota Bouquet. Enjoy more entertainment on Nyota.
All the days and the nights, reading for them and to them. You don't stop, and neither do we. Help build a strong foundation for your growing child with Nestle Nunkid. Nestle Nunkid 4. Our best for you.
Why do we do it? Hide, cover up, tone down? Choose boldness. Celebrate the skin you're in and dress with confidence with Nivea Nourishing Cocoa Body Lotion. The triple layered care of deep moisture serum, precious cocoa butter and vitamin E enriches your skin for 48 hours. It's time to show off your best skin. Wear your skin with pride every time with Nivea Nourishing Cocoa Body Lotion.
About Molfix.
Actually, another brand was recommended to me, but it had a leakage problem. Then I decided to try Molfix. His clothes don't get wet anymore.
Because Molfix provides extra protection against leakage thanks to its anti-leakage elastic barriers. All babies deserve a high-quality diaper. You should also try Molfix.
Be sure, check out for a KDIC sticker in your banking hall. KDIC, protecting your deposits.
A place in your heart.
Don't you dare touch me!
Miss Berta, that's enough! You're going too far!
You're going too far! How dare you touch me! You
We're
and your
going
mother!
to pay you in full!
Really? When?
This kidney here will pay for my brother's tuition. And as for this liver here, it'll pay for our house, our monthly rent.
Why? That's not the only thing your son will get. This isn't the end.
Third, I swear to you, we'll pay. We're going to pay.
A place in your heart.
Weka pesa yako kwa panga account juu KDIC imekuhakikishia iko safe. Weka kitu kwa panga.
Be sure, check out for a KDIC sticker in your banking hall. KDIC, protecting your deposits.
your world. My name is Gladys Gachanja. The conversation is the impact of new media on healthcare. And still with us, Dr. Christina Sule, Dr. Rain, and of course, Dr. Nancy. But before we get back to that conversation, let's take a look at the other world. Now, pregnant women receive a first dose of the Pfizer vaccine against COVID-19 in the Colombian capital, Bogota. Now, Andrea Caro, who was receiving the first dose of Pfizer COVID-19 vaccine, said she feels that this is something that is going to help both my baby and I. Now, Daisy Martinez, also an expectant mother receiving her first dose, said, I really feel reassured to know that in a few weeks, my baby is going to be born and she is already immunized against this virus, at least with the first dose. So I'm really happy to know that we were able to apply this dose before she arrived. Now, Haiti bid farewell Friday to its slain president Jovenel Moise under tight security at a state funeral marred by an eruption of gunfire outside the venue, highlighting the instability of the impoverished Caribbean country. Now, just over 2 weeks after the 53-year-old Moise was shot dead in his home in Port-au-Prince in the early hours of July the 7th, he was interred in Cap Haitien, the main city in his native northern region. And now the open-air funeral lasting several hours. Moise's coffin was draped in the red, white and blue Haitian flag and the presidential sash and surrounded by flowers. Now military guards kept watch and soldiers performed the national and presidential anthems. Elsewhere, a museum beneath the waves at Peristera, a rocky outcrop off the island of Alinosos in Greece, opened in 2020. Though the site has been largely mothballed until now due to COVID-19 restrictions. As Greece opens up its vital tourism industry, the site offers an example of a new and more sustainable source of revenue.
My view, it makes it special and unique that it's a combination of diving and archaeological diving. So it's diving into history, and it makes this place life and life again. So this is what touches me.
Well, it was just with a different perspective, we're not watching only marine life or corals, but watching ancient civilizations, and I was just, while we were down there, trying to imagine what it had been like being on a vessel, transporting wine and from one shore to another. It was just amazing.
The experience was great. Yeah, my expectations were already high from the briefing, and it fulfilled everything, all my expectations.
And we're very excited to have another 4 wrecks in the following 2 years, and that is really going to put Alonisos on the world diving map. We're going to have like an underwater safari of ancient wrecks.
Well, the Colombian president signed a decree giving the green light to export dried cannabis flowers for use in medical products, in addition to allowing manufacturers to produce goods such as textiles or food containing the plant. Now, in a bold embrace of a booming global market, the president signed a decree ending the ban on the export of dried flowers in an event organized at Clever Leaves, one of the 18 multinationals that grows medicinal cannabis in Colombia. So back to our conversation, the impact of new media on healthcare. And I'd like to know from the panelists, I'll start off with you, Dr. Christina, what has the social media platform taught you about your discipline?
So the social media platform has taught me that women do care about their reproductive health. They really do. They want it to be streamlined. They want the right things happening. They care about it very much. It has also taught me that reproductive and sexual health has been kind of toned down for a very long time, and women are now looking at their sexual and reproductive health in a new light, and that's fascinating, and it's good. Mm-hmm. At the same time, it has taught me that you can build a relationship with a patient virtually. And that's a very important thing for me, because when a patient walks into my office after having seen me on social media or watched any of my videos, we're not starting off from the place that every other doctor is starting off. We're starting off because we feel like we've related to each other. I feel like I conveyed information to you, you listened, and you came because you felt like this is somebody I can trust, yeah? And that relationship is very important because it makes my work a lot easier. That's a patient who, other than coming from a point of knowledge, so I'm not starting off from zero to explain, you know, this is what this is. But other than that, it's much easier for me to be able to convey the subsequent management that we're going to have. So it's easier for me to tell you, look, did you watch my video? Do you remember I said if you have fibroids, you're going to need a surgery? Yeah. So they say yes, and I do trust you because I've watched, I feel like I have related to you. So it has allowed me to develop relationships with patients and with women without actually having met them. It's allowed me to understand that women do care about their sexual and reproductive health, and it's also allowed me to understand that early diagnosis really does prevent later on disease, and it really does help me. And I'm able to see that practically, that look, the reason why we're not at stage 2 cervical cancer is because somebody watched a video 3 years ago. Mm-hmm. And so I feel like those are the ways in which it has helped my practice.
Okay, and Dr. Rain with the pediatrics.
So for me, especially I would really encourage more healthcare workers. We need more people to educate the masses. We need more people in different languages. For those who are in Mandera, we need healthcare workers speaking in that language. For those people in Lamu, we need to speak to the Bajuni people in the language that they understand. But what I'd encourage healthcare workers, get into social media space. Social media is also a very dangerous space that can lead to a lot of mental health issues. So own your craft. You're not there to seek validation. You're already a certified medical practitioner. You are there to educate people. Some people might not agree with what you say, but as long as you are giving information that is based on facts, whatever they might throw at you, don't take that too much to heart. Try to reach out as much as possible, but you can't please everybody. It's a beautiful space. I'd attest to what Dr. Christina Sule has said. I've seen so many mothers who have watched my very educational videos on YouTube, or I've seen what I've done on Instagram, and then when you meet, it's much easier. You've bridged the gap. We don't have to start from scratch again, and you start building better relationships. So I would encourage all the healthcare providers out there, use this social media space to be more accessible. Nobody's passing around business cards anymore unless it's word of mouth. So just be visible. Be visible where you need to be visible, so that you can improve your accessibility and you can improve the quality of healthcare that you give to your patients.
Definitely information is power. Dr. Nancy, definitely with the mental health awareness, the social media platform has come in handy, as you have mentioned, and we continually see. What has it taught you as a practitioner?
Yes, that information is power, and being authentic and being professional. Because what I have gotten from many clients is, I watched your video and I felt I could talk to you. I have had clients talk about the video was very therapeutic and you seem to know what you're doing. And I felt if we have more professionals out there, like Dr. Rain is saying, that people can see that you understand what you're working with, what you're dealing with, they're able to access proper help. We have many people who are blogging, and not all bloggers are doing a bad job. A lot are educating people out there, but sometimes the information people get online makes them minimize their symptoms or get them to feel invalidated. So when we have these professionals getting out to get the information out there, then when people come to us, they feel like they are able to trust us, and they can be in that space, get the help that they need.
And it's interesting, somebody says for them, getting medical healthcare information online has actually humanized the doctors that they interact with. Have you had that feedback, Dr. Christina?
Yes, I have before.
Yeah.
I think previously, the medical field and how patients interacted with doctors was very closed. You would be given medication by a doctor, and when you ask, why have you given me this medication, it would basically be because I said so. Yeah, because I'm the one with the medical degree, not you. But this new interaction allows us, allows the patient to feel like, look, this is a human being just like me. They do truly want me to get better. They're giving me this because they have studied, because they have examined me, because they've interacted with me. They're giving the same treatment for the same condition to other patients, and therefore there's a more human interaction. Right now, once a patient has watched your video, for example, on a social media platform, they can come to your office and say, in your video you said this. Is this actually true? Can you confirm this? How many patients have you seen with this? And so then it becomes a much more human interaction, and I completely agree with that.
Now, doctoring, there are those who look at this and say it's a good thing and it definitely should be encouraged. But even as you give the information, have you walked into this space and realized, oh my God, I thought this is the missing information. There's a lot more that needs to be done.
Sorry, come again on the last part.
Have you ever come back to it and said, I was going in with this objective, but realized there's a lot more information needed than I thought I need to put out there? Definitely.
There's definitely a gap, and I can't really echo more what Christina is saying about it's humanized us more. For me, I have really tried to sort of document my journey about being a resident and just working in public healthcare and working in private healthcare, and the differences and the gaps in between that. And people understand that you're a person. There's this perspective that when you're a doctor, you know, you're swimming in the money, you're swimming in the loot. I can remember when I first became a doctor, the phone calls from family, relatives, friends, asking for loans. But then when we start exposing what we go through, the money, the delays, the struggle, the mental health issues that we deal with, people are like, oh my gosh, so these doctors are really, really having it rough. But at the same time, when they see us go through that and we're trying to offer the best to the patients, then you get to be viewed as a human being, as opposed to be seen as a professional who is just charging all these consultation fees that they don't seem to understand. So it helps to bridge that. Do we have a lot of misinformation, lack of information out there? There is so much. Sometimes I don't know. I have to take a step back and say, okay, today I can't post a video, because sometimes it can get very frustrating when you're the one who knows. So you have to sort of step back, breathe in, meditate before you go really, really ham on social media, and just understand that you're the one that has the information. That's why you're angry. They don't have the information. If you don't have the knowledge, then you can't make an informed decision. And that's why people are making so many bad decisions out there. So there's a big gap. Like, I want there to be more Dr. Rains, I want them to be more Dr. Sules. I want everybody to embrace in all our specialities so that we can really bridge the gap and really bring healthcare to the people.
And Nancy, I mentioned that I could easily christen you as a last born when it comes to dipping your toes in the new media space. Would you encourage others who perhaps are seniors like you are onto the same platform?
Definitely, yes, because that is destigmatizing the mental health issues. People can openly talk about it. People are saying, oh, I'm not the only one going through this. This is something common. This is something that makes people go to seek therapy or to seek help. And therefore, talking about it out there and asking more professionals to get out. And I know it's quite uncomfortable. Like I said, I was forced into the space because of what I was experiencing in therapy. just saying, I need more people to know that they don't have to leave their jobs, break their relationships because of mental health issues, commit suicide. We have seen even medical doctors going through that because of also being overwhelmed, and that they can also get sick mentally and they also need help. So getting more people out there to say that there is help, and we are here, and we are qualified, and we have trained properly to be able to walk you through this journey as you get better. I think I would really encourage that. And I have seen lots of benefits with that. Yes.
Okay, now even as we bring this conversation to a close, definitely the impact of the new media on healthcare, again, cannot be understated, but it can only thrive in a 360 outlook when it comes to the general healthcare. For you, Dr. Sule, when it comes to the reproductive space, how can the healthcare system better support patients in accessing quality healthcare?
So, of course, quality healthcare in Kenya is actually unaffordable. And that's the truth of the matter. It is unaffordable. So affordability would be, the first step. Even before, social media is accessed, affordability really has to be the first step. The other thing is that, as Dr. Rain had mentioned before, both private and government facilities need to be able to have patients access the hospital from the comfort of their home. As a patient, I need to be able to get onto an online platform of a clinic or a hospital. I need to be able to interact with the doctors directly. I need to be able to know what the services are about. I need to be able to book an appointment. And that accessibility in terms of a virtual platform is something that all hospitals are going to have to take up, because COVID will pass, but people will be used to the way life was in COVID. We're not going to be able to tell people like, oh, take your phone, dial the hospital. No, there's no way you can speak to the doctor. That is gone. Right now, a patient needs to be able to log into Kenyatta National Hospital, see, okay, who are the pediatric surgeons in Kenyatta Hospital, tell them, look, this is the problem that I have. I've been diagnosed in 1, 2, 3 hospitals in the periphery. I would like to speak to the pediatric surgeon. And I think that should be accessible. So accessibility and affordability is a big issue in terms of how the healthcare space needs to open up to patients.
And some of the other attractive factors are definitely acceptability and availability. Dr. Rain.
Come again with the question, please.
So the question was, how is it that the system, the healthcare system, can be propped up to ensure that it actually supports what it is that some of you are doing on the social media platform? Because at the end of the day, accessing healthcare is a 360 thing.
We just need more support from infrastructure support, system support. So like I mentioned, like the telemedicine is a beautiful thing, but it has to be done the right way. Regulations, proper bills have to be passed. And whenever these bills are being passed, sometimes I feel like we bring doctors on board, or we ask doctors a lot of questions. So much is expected of us, yet for us, what determines our quality or how we provide service to you has got so many things behind us. Do you have enough support? Like I said, healthcare is a business. Does this person have health insurance? Does everybody have access to NHIF? Does everybody have access to private healthcare? And what is the difference between the public healthcare that you are providing versus the private healthcare? Because I don't feel like there should be a disparity per se. When you do go to a public hospital, it should be just as good as a private hospital, if not better. That is the real definition of universal healthcare coverage. So we can do our part, we can play our part. We're already doing it. So if we can do more research and more studies, because it's still something relatively new in our country. So we definitely need to do more research and more studies and to see the experiences, get the actual facts, get the actual numbers, so that we can see how we can implement this nationwide to bigger platforms, get bigger support. We need a lot of IT infrastructure. You need a lot of medical records and data storage and data management that is important for the patient. So all these, trust me, we did not train. Ours is to get on the screen, speak to the patient, try get that connection, try find out what the problem is, and hopefully be able to give you a solution over the screen. And if we can't give you a solution of how you can come and get healthcare access physically.
Now, Nancy, definitely there is a time that mental health care has really been given, I guess, you know, the attention it deserves is now. Albeit late, but still timely. For you, what more needs to be done?
More awareness. And I like what the media is doing. I think all media houses have had professionals talk about mental health issues, getting people to know that that there is that need, and the government can also support better by probably putting in more resources in the hospitals and more professionals in the hospitals and hiring more psychiatrists and psychologists who can support with mental health issues. Because we also know, and we have research from the, I think, in the International Hospital, that 1 out of 4 people seeking physical help in hospitals have a mental health issue. So that is worrying when you think that it's not just diabetes or even hypertension that they are going for treatment for. There will be a component of mental health issue. And when we consider the psychosocial and spiritual model of treatment, where we are looking at the individual in a holistic way, that we are not just looking at the physical body, we are also checking their mental health so that they can be supported better. So the government can do more, and I think individuals and organizations, workplaces can also do more to talk about mental health issues so that people can be aware and get to know what they can do. And also the professionals can get out, like I'm trying to do, and others are trying to do, so that when people know, then they can seek help even from the nearest mental health practitioner that they'll be able to access.
Thank you, Dr. Nancy Nyaga, clinical psychologist, Dr. Brian Gala, a.k.a. Dr. Rain, who is a pediatric resident, and of course, Dr. Christina Sule, obstetrician and general and cosmetic gynecologist. I mean, this was a very important conversation, and thank you for being part of it. Dr. Rain, we salute you. You are on night shift, but you still made it here, still in your scrubs. Asante Sana, and we do acknowledge the work that you're doing on the online space to educate and empower the masses in as far as taking up their own health and wellness. Now, tomorrow, we take up a little trip down memory lane and revisit how you spent your first salary or first income when you opened that business. Do you kind of wince every time you think about how you threw your potential seed capital to the wind just because you were not equipped with the right information to handle money? Well, tomorrow from 7 a.m., we get very candid about financial literacy as I engage experts on the same. See you then.
Presenting the new Harpic Bathroom Cleaner. Compared to ordinary detergents, its thick formulation gives you superior cleaning and kills 99.9% of germs and viruses all around the bathroom. Blue
for the toilet
and red
for the bathroom.
Kids are creative. They can really dazzle with words, and the people around them love the way they write. That is why at Sawa Soap, we are giving all class 6 and 7 kids in all public and private primary schools in Kenya a chance to dazzle Kenya with words in the Sawa Creative Writing Competition. Just write a creative 200